Oh yeah, and say your year in PT school.
Oh, I'm a third year.
I'm Jayla. I'm a third year PT student, and my favorite specialty is pediatrics.
I'm Lydia. I'm also a third year, and my specialty ortho to the bone.
I'm Nehemiah from here in St. Louis, another third year, and my specialty is cardiopulmonary.
I'm CJ from Chicago, third year as well. And like Lydia, my specialty would be ortho.
All right. I'm driving right now, but Sydney, you can pop it off with some questions that we received via social media.
Y'all couldn't hear me. Okay. Um, okay, first question. It says, on average, how often do you study per week? Answer this if it's like first or second year.
Okay, I think it depends because there were some times where I think I would study at least like 1 to 2 hours a day, first and second year. And then when we were having a test, which was like every other week, like I would like study more on the weekends and then kind of cram like 5 hours. But yeah, I don't think I went over like 4 or 5 hours on the weekends because I had a job. So
I would say same-ish. I probably study a little bit more on the weekends, just depending on what we were studying. Um, so yeah, 2 to 3 hours during the week maybe, and then on like the weekend before the test, I'll probably study around like 6 or 7 hours on the weekends, something like that.
Yeah, I'm similar to Lydia. I know on the weekends, usually in the mornings, it was more like independent study, and then going into the afternoon, there are other people from class that would show up, and we just kind of like talk over material. But the time frame is still the same as what Lydia and Jayla both said.
All right, next question. How much time do you have for leisure activities?
I think it's a little difficult for me to answer, because our schedule kind of bounced around a lot. We didn't really have like a specific curriculum where we went 8 to 5 or 9 to whatever, 10 or whatever. But I know for me, I just kind of had to find time in the evening for those things that I wanted to prioritize. If it's working out or just hanging out with friends, um, it'll always be sometime in the evening that once we're done with classes, or maybe on a weekend, it'll never be in the morning because I'm just not a morning person at all.
I would say like similar. I don't, unless there's some people who like choose not to study on Saturday or choose not to study like on Sundays or something. And if you choose not to study on those days, then you would have free time on those days. But I think overall, if you want to do something, you have to like prioritize it and put it in your schedule because there's not really free time. I would say for me personally, and from the people that I'm around most of the time, there's not just free time. If you want to do something, you have to make it fit in your schedule. Like for me, I try to exercise like 5 days a week. So around like 5 or 6. I always make sure I go to exercise at that time every day, and I would just work my studying or my class schedule around that time. I didn't really have time to do it. I had to work around that time. So like CJ said, kind of like prioritizing it.
And on the day to day as well, I would usually give myself like hard cutoffs throughout the day, unless it was test week and I like really needed to study to do well on the exam that was coming up. But if I'm just like studying content that's going on in class, if a certain time hits and I haven't got through all that content, I'll just shut it down and pick it back up the next day. Because I think it's easy to get bogged down because there's a lot of information you can go over. And if you don't set those hard limits, I think it's easy to get carried away and study way more than you need to and get burnt out.
Okay. Key things you need to know before attending PT school, especially coming from an HBCU. And also, just disclaimer, people that are in here, you can drop questions in the chat whenever you feel the need, and we'll go from there as well. I'll actually pick this one up since I went to a HBCU. Key things that you need to know. So I think having a good foundation in anatomy and physiology was the most important for PT school. And also having specifically exercise physiology knowledge was helpful as well, because we just cover those topics again once you're in PT school. So I think a lot of us prior to coming to PT school think that we need to know all of this information in order to be successful, but you go over the same information again. So it's not like you're at a disadvantage. If anything, you'll just be at an advantage if you do come in with that extra knowledge, but you won't be at a disadvantage if you don't, since you go over the information again.
Do you remember repeating the question just so I can make sure I understood it?
It says key things you need to know before attending PT school, especially coming from an HBCU. So I think you can answer either way if you went to HBCU or not.
So I didn't go to HBU, so I can't really speak on that. But I will say things you want to think about next to what Sydney already said. It's you want to think about the financial burden of physical therapy school. Think about start figuring out how you're going to allocate your finances towards physical therapy school, figuring out like stuff like living situations and things of that sort. And also, you want to also continue to prioritize the things that matter to you, if that's families, friends, specific activities, just making sure you're keeping your mental health as important as it was before school when you enter school, just because that's going to be something that you're I'm not going to wish that on anybody, but it's just going to be ups and downs throughout 3 years or 2.5 years of physical therapy school. And you want to try to keep that support system around you and try to keep your spirits high, even when sometimes it's hard, just to make sure that you're able to still get through the rigorous process of physical therapy school.
I also went to an HBCU. I graduated from TSU, Tennessee State University in Nashville. And I felt like the base level education that I got there was not up to par in comparison to my classmates when it covered some of the more like the cardiopulmonary topics, or like we took anatomy and physiology, and I don't think anybody learns anatomy and physiology to the extent that we learn in PT school until you get into PT school. But I would say my base level of exercise, like kinese and cardiopulmonary, just wasn't up to the standard of what I felt like some of my classmates already knew. So I felt like I needed to study a little bit more just to get to what they knew, and then a little bit more to learn what we needed to know for like to be a physical therapist. So like Sydney said, you're not really at a disadvantage because they do give you like all the information, but then like when we're answering questions and talking about it, you realize, oh, some people already know a lot of this stuff and you hadn't even been introduced to it. And I felt like at TSU, they just didn't offer like that level of education, which it's fine. You just have to spend a little extra time learning it. Sometimes, like if you pick up quick, you'll learn it quick and then you'll move on. Or if it's something that you're not even interested in, you may not need to spend forever studying it. You just need to learn like the bare minimum of what you need to know. Yeah, I feel like that's my main experience.
I just wanted to second everything that Lydia said. I went to Prairie View A&M University, and I felt exactly the same, especially in cadaver lab. So some undergrads have cadaver lab a part of their anatomy and physiology. So that also is like a learning curve that we have at some HBCUs. But like Sydney and everybody else said, you do have the opportunity to catch up with everybody, even if they were exposed to other things that you weren't.
Also, another thing, just quickly, because we go to WashU, which is heavy on research, there was also a lot of like evidence and statistical stuff that I was not taught. And if you're introduced to that when you're an undergrad, or if you participate in research studies when you're an undergrad, you will be at an advantage for sure when it comes to that. But it's a small topic that's tested and required for entry level. But at our school, we went over it a lot because that's what their like primary focus is on, research and evidence-based practice, which most schools should be. But that's another area like specifically that I felt like I wasn't like up to par.
I can read the question in the chat. So it says, I'm minoring in psychology, but majoring in exercise science, pre-professional. I wanted to know, is having a deep psychology background a good essential to have before entering PT school? I think that I wouldn't say that like having a psychology minor or like having like a good base of psychology is essential, but I think it would really benefit from some of the classes, especially with like neuro classes or classes that talk about like the psychosocial determinants of health. And then just to have that psychology background, I think you have like a good advantage in different things that you might not think of. But everyone in PT school has different majors and minors. And I think it just like shows their strengths. Like we have one classmate is like super good at biomechanics because she has a degree in bioengineering. Or so like she's really, that's like one of her big strengths, but like she might not have a big strength in something like, oh my God, stop calling me. Okay, something like psychology. So yeah, it's just like a strength and weakness that you can have as a student.
And I will say, I will, to piggyback off what Jayla has said, I will say that it could be beneficial in the sense of understanding human behavior and the different mental processes that or expected things you may have a better understanding of how someone may respond to different wording, different treatments, interventions based on your psychology background that a few of your classmates don't have just because they're not familiar with psychology or just people, social interactions, or just how people may respond different ways. And you may have a better understanding to why somebody is responding a certain way, so that when you respond to how they are responding, you respond appropriately based off your knowledge of how they responded to whatever the situation is.
Yeah, I agree. Oh, sorry, you can go, Nehemiah.
Thanks, Cindy. Yeah, I agree with CJ. I was gonna say something similar as well. Like having that background will definitely help in like clinical care once you are on clinicals and working with patients. A lot of PT school, it's like, you know, your anatomy, physiology, a lot of that book stuff. But another part that you're graded on throughout PT school and what's really going to elevate you and carry you through your career is how well you can understand and relate to the people you're working with. And so having that background knowledge, I think, is pretty valuable for that.
That's exactly what I was going to say. So I agree. Okay, we have another question in the chat. It says, what would you say you wish you would have done academically or volunteer-wise before getting into PT school, or have you done that, or you have done that has made the transition easier?
I think it's hard to say like why we were all accepted into PT school, because you know they don't tell you like we saw all of this on PT Cast and this is why we chose you, you know. But I think like having some type of extracurricular, something that shows your personality will like carry you. I know like one thing that I wish I had done before coming into PT school, like anywhere that I went, is just been more involved in the research process. So that's something I didn't have a background in. I had like a few sports and clubs, and obviously like the shadowing hours that are required to get into PT school, but I wish I had done more in research specifically.
I would say academically, I wish if I could go back in time. Everything happened for a reason, but if I can go back in time, I wouldn't have gotten a master's. And I say that only because obviously I got into PT school the year after I got my master's. So I'm really not going to use the master's. It's really just a financial burden to me, to be honest, that I'm just going to be paying for. I really wished I would have had the self-confidence in myself to believe that I was enough and I had did and accomplished enough to be admitted into PT school and not feel like I was inferior to my counterparts, to think that on top of getting a bachelor's degree, I needed to go get a master's degree just to feel like I'm on the same level as others to get accepted, if that makes sense.
I think that I would have wanted to do more like shadowing and volunteering in like different fields. Well, and like part of it isn't my fault because like of COVID, wasn't allowed to shadow a bunch of places. So I mainly did my shadowing in outpatient orthopedics. And I wish I would have like done more like neuro, more pediatrics, just so I can have a feel of like what I actually like. Because even with shadowing, like even before I went into PT school, I knew that like I felt like outpatient orthopedics was boring. So like so if I didn't have like a experience before with an inpatient neuro rehab, then I probably wouldn't have picked PT. So I think just like widening your range of options within PT would be good.
I can speak on this from the opposite end on things that were done to make that transition easier. With me, I was in a physical therapy assistant program in undergrad, and so I feel like that made the transition into PT school a lot easier, at least for that first year. Having that patient experience and like hands-on experience with like interventions, exercises, just handling of patients. And so that made the first year not as daunting for me because it felt like a review of a lot of the content that I had gotten. but there's still, that discrepancy between, PTA, PT. So I still had to work pretty hard on all the new content that we're getting, but it made the burden feel a little more manageable.
Also talking about one thing that made the transition a bit easier, specifically for anatomy cadaver lab so once I got accepted into PT school, I went to a 1-month summer program at University of Maryland Eastern Shore, and they offered an anatomy course with cadaver lab. So prior to, I had no experience with cadaver lab, have never seen a dead body, anything like that. So going to that program, we had exams, we had quizzes, we had class every day. So it kind of put me in the mindset of what it would be like once I transitioned to physical therapy school. And even just like the whole exposure to a cadaver lab, because that can be a little daunting for some people. It didn't personally bother me, but I know that is a touchy subject sometimes because it is a dead person. So sometimes that can be a little shocking at first, but that program definitely exposed me to different concepts and gave me some strategies to take with me to physical therapy school that I think was pretty helpful. We have another question in the chat. It says, how did you all know PT was the right route for you?
I remember, I'm trying to take it back because PT school has been traumatic, I'll be honest. When I was in undergrad, I remember wanting to be a PT, like wanting to get accepted into PT school so bad. I did a lot of shadowing. I did a little bit of shadowing when I was in high school. Like I did this volunteering program, and the first patient that I worked with was like a stroke patient. Obviously, that was the first time I had seen something like that, and I saw this huge recovery that he had made in a couple of weeks, and I thought that was really cool. And ultimately, at the beginning, I really wanted to be a physical therapist for an NBA basketball team. Like that was my whole goal of going to PT school in the beginning. That's what I felt like. And I had talked to some sports therapists and had shadowed them, and they made it seem like it was just awesome. Like you're treating these patients, they're highly motivated, they get better, they get back on the field, you're traveling. I was like, yes, this is what I want. And I just felt like that's where my spirit was pulling me. So I just went with it. And while I was in PT school, I enjoy the information that we're taught. We're taught amazing things. You learn so much about the body, what your body can do. And I grew closer and closer to wanting to be a physical therapist while I was in PT school. It's extremely hard, extremely stressful, very emotional, but learning more made me want to become a PT even more. And I just kind of leaned into where I felt like my spirit was pulling me. That's what I felt like. And once I got accepted into PT school, I was like, okay, we'll go for it. I think you just kind of have to take that leap if you're it's a big sacrifice. So maybe just talk to people that know you well, or people that you feel like you can be open with, and kind of dissect why, the pros and cons of what your life may look like once you are a physical therapist, and see what that is for you. That would be my best advice.
I think what led me to PT was that I was a dancer before, so we had a pretty good I had a pretty good general knowledge of anatomy, and I really liked anatomy and kinesiology. And I really love science in the healthcare field. So basically I I went with physical therapy because I didn't want to be a doctor. I didn't want to deal with like meds and pharmacy. I didn't want to be a nurse because I didn't want to wipe any butts. Yeah, so I was like checking off like no, no, no. And as like I went through undergrad in my exercise science major, I was just like, well, you know, like what else would I do? And I literally could not think of like any other job that I would want to do. So I think that's why I was just like, yeah, like I need to be a PT because like I can't even think of anything else I'd rather do.
I'll say I'm similar to Jayla, and I really couldn't imagine myself doing anything else. PT, I had to go to physical therapy back when I was younger in middle school, and that was kind of my first experience with it. And I was like, oh, this is pretty cool. Like, I mean, I'm a middle schooler. I'm like jumping around in the gym with the therapist. I'm like, oh, this is fun. Like, I wouldn't mind being able to do this with patients in the future. And so I think as time like went on, just doing more research into the field, kind of developing that love for like sciences, also with like being active and like just promoting like movement and staying active and physical fitness. And so I was like, this just seems like the perfect blend of the two. And I think the thing that really made me think, oh yeah, this is what I want to do, is that I had a uh, volunteering stint at Rankin Jordan Children's Pediatric Hospital here in St. Louis, and being able to work with those therapists and like work with the kids, it just I just felt very it was very rewarding being able to like work with those kids and see them improve, or being able to like talk to the family because you know they're going through a tough time, just being that like sense of support. And I think that's kind of where I fell in love with the profession. It's like, yeah, I think I'm going to see this thing through. Didn't end up seeing it through as a peds therapist like I initially thought, but but still making it through nonetheless.
You'll make it back. Don't worry.
He just might.
Yeah, I mean, I'm volunteering with a lot of kids now, so that's my medium. I'll take that.
There you go. Okay, so before we get to the next question in the chat, this is kind of like an add-on to the question that we just answered. Why PT instead of OT?
If I'm just being transparent, when I first learned about PT, I didn't even know that OT was a thing. So I think I didn't learn more about OT until I was in my PTA program at CMU. But now with being through the PT program, I still think I choose PT 10 out of 10 times. I feel like there's strengths and weaknesses to each one, but I feel like there's a lot you can do in PT with your patients. It's really, really functional on getting patients like back to their lives, back walking, back moving, back to getting them that sense of independence. And I know OT also touches on that as well, but I feel like OT tends to be more towards self-care, which is also really important, but PT is really driving getting people back out to living their lives as independently as they can. So I really enjoy that aspect of PT as opposed to OT.
I think OT is very like underappreciated, but I also would not want to be an OT because like I said, I don't want to wipe butts. I don't want to give you a shower. Like and OTs like and PTs do that too, but that's not like their job. Like they can assist OT in the shower. Like I've assisted an OT in like doing a shower and stuff like that, but like my job wasn't to shower the patient. It was like transfer the patient over and make sure the patient doesn't fall while the OT is giving the shower or helping the patient give the shower. So like, yeah, I would agree with Nehemiah. Like self-care is very important for a patient to be able to like care for themselves independently. But it's just not my jam.
Okay. Okay, so next question in the chat, it says, I know you all mentioned that there is a lot of information provided during lecture, lab, and async. For someone working or on that, I can't read, obviously. For someone working on that may have to work while in school. If you are concerned with not being as successful because you are struggling to cover all of the material or additional resources provided, what would be your advice to help manage this? Is this more so like a time management question, like balancing?
Yeah, that's the biggest thing. I mean, I've gotten better with it, but just I think the biggest thing that I was going for with that question was like, I know at least with our program, we have a lot of material. I have a lot of classes like a type A in a sense, and they're always like, we have so much information. They're always stressing, like even people that don't work about like, how am I going to pass the next test? Because Stacy or like whoever is giving us 20 different links or 20 different resources, 20 different articles, and I have no time to recall. Like, am I still gonna be able to pass that? In all sense, keyword that test. And so that's what I was.
You gotta focus on the PowerPoints.
Yeah,
You
honestly, you
gotta
gotta just balance your time. And I feel like we feel like we need to know everything, especially when it comes to exams. But honestly, that's not even feasible sometimes because the amount of information that we receive on a daily basis, especially during second year, you're bound to miss something. And I think you find comfort in that. At least I did over time. But at least knowing the majority, but knowing that being comfortable in knowing that you won't know everything or won't get to everything and being okay with that.
I can also speak on like having a job because I loved having a job. Like I wish that I had my job right now, but I like stopped doing it so I could have more time to study for boards. But like it gave me so much like it gave me something that I could walk away from and not think about PT. And then but it also gave me like a structure to where it's like, okay, I have to be at work at 4:30. So I only have like if I'm waking up at 8 or 9, like I only have this amount of time to do like to study. So I'm gonna focus on it helped me focus on the things I needed to focus on versus like, oh, I need to get through everything. I need to reread all of this and rewrite all that. Cause like it even if I didn't have a job like that's just like what Sydney said, it's just not obtainable and not feasible to know everything. So I think it helped me in a way of where it was just like, okay, well, I'm just going to focus on what I feel like is important and hopefully pay attention to the objectives and hopefully that's what's going to be on the test.
Okay. Next question is, what are some stereotypes you have encountered in class and or in clinic, and how did you handle them?
Stereotypes in class that we've experienced are just like some of the outsiders coming in, and when they start rambling off about statistics about black people or different races, they make it their verbiage makes it sound like because we are black, this is what's going to happen to us, rather than going taking a deep dive into why this specific person or population may have this specific diagnosis or prevalence in this diagnosis. So that's something that we've had to deal with. I one day tried to challenge somebody, it didn't go very far, but I tried. In clinic, there are going to be things. Well, I seen from my experience, there are going to be random things. I didn't have I didn't see any Black physical therapists where I worked. So I was the only Black person there. And on top of being the only Black person working there, wasn't too many Black patients as well. So there was a time where there was one white patient that just was so pressed on trying to connect with me that she started telling a story, and she was like, "Oh, you'll love this story." And then started and only said I love the story because it involved a Black person. And honestly, it was about like some Black old maid that she used to have. I honestly could care less about the story or anything, but she just felt that because I'm Black and the person she's about to remember randomly at this point in time is Black, that's going to be our connection right there. So it's going to be, there are things that you're going to deal with that just may be out of your control sometimes. But how do you handle it? I would say you handle it by just continue to be pressed on your morals and values and stand up for yourself and speaking up for yourself and be willing to defend yourself when you see any injustices or when you see wrong, and be able to defend um, Black people or whatever race you are, in a sense, when you see somebody randomly stereotyping you or others for no apparent reason.
Yeah, I agree with CJ. I had an instance over my third clinical. It was in Columbia, Missouri. It's kind of surrounded by a lot of small rural areas, and there's a patient I was doing an evaluation on, and I walked in. And he was telling me the story about his friend. He was like, "Oh yeah, he was a color guy just like you." And I'm like, there's worse things he could have said, but him saying that kind of took me aback. And so I'm just like, I just gave him a look, just kind of tilted my head and looked at him. He instantly like kind of backed off. He was like, "Oh, I wasn't supposed to say that, was I?" And I was like, "No, not really. That's not really the term that we use anymore. That's not it." And so I think it's yeah, like CJ said, definitely, stand up for yourself in those situations, but also keep it professional and respectful as well. But yeah, it will come up. That's kind of the nature of the beast, especially with us being, the minority in the country, especially in this field. But standing up for yourself, having respect for yourself, and respect for your culture as well. I think that's very important to always keep in the back of your mind, because you never know when a situation like that might happen. It was 8 a.m. on a Wednesday morning, and I wasn't expecting to have to have a conversation like that. Still digesting breakfast, so it wasn't great, but we got through it.
Yeah. So yeah, these things may happen. God forbid we don't want them to happen, but that's just how society is. You just want to make sure you again stand up for yourself and don't allow anybody, even for the sake of a grade, allow anyone to disrespect you or disrespect your beliefs and your culture just because of their own beliefs and their own cultures and what they think society, what's norm for them in society, even though you take offense to that. Like, speak up for yourself. Sure.
Sorry, I'm jumping in here. Oh, go Janae, go for it.
Oh, I just wanted to say one reaction that we've had to different stereotypes is just starting NABPT, like letting that be the fuel for wanting to make a change. Because a lot of stuff that you'll be taught or the things that you encounter, like CJ said, it's societal and it's hard to change, but like there's stuff that we can do within our control. And like that's just one thing about NABPT that I love, because like one of the things that we wanted to found on was like changing the narrative. When you are hearing that like, oh, African American people were having a higher risk of hypertension, and you constantly hear that, it's like, okay, she's not going to change what she's saying. So what can we do to change that narrative? And like through different community service opportunities, and just being engrossed in the community, I think that's a big part of PT as well, and something that we have in our back pocket that we can use.
Okay, next question. Are there things that you all have found that you still struggle with as you all get closer and closer to being licensed and out on your own? Personally, for me, I think I struggle most with confidence. I think that's my biggest barrier when it comes to patient care. And at some point in my journey, I will come to the realization that I do have this array of knowledge that I've accumulated over these past 3 years between didactic and clinical experiences that I actually do know what I'm talking about. And then also being comfortable in not knowing and being able to say that you don't know something, being able to go and find the answer for that person. But yeah, confidence is my biggest one.
I think what Sydney said is really important because I personally have not had clinical experiences in all of the settings. So I think like in PT school, you learn like the signs and symptoms of when things are really wrong or when things are really good. And that's what you need to know. And everything else in between, you kind of have time to figure it out because PTs are different in that area. Like you see your patient for a longitudinal amount of time. So you're able to continually make adjustments to your treatments and being comfortable with not knowing, but knowing that you know that you can figure it out is okay. And you know when to refer someone out if something is wrong. Or if you see that they'll do well with just like a home exercise program, you can give them that and then send them home.
I can read the next one. Do you all know of any internships or jobs that can help build my resume while still being an undergrad student? Yeah. Well, no, I don't know any. But I did do an internship at like an outpatient uh orthopedic clinic along with a combined with the chiropractic clinic. And but I had to do the internship for my degree. So that was like I spent a lot of like hours there and just like learning. I spent a lot of time like up front and as like a tech. Uh and it was really good learning experience and they were like really cool people. It was just a small clinic. Um so I think if you could get an internship doing something like that, like being in a clinic, or you could work as a tech, or you could, yeah, work as a PT tech, maybe do something like how Nehemiah, well, I don't know if you can do that now, but as a PTA undergrad program, I don't know. Something where you just like get your foot in the door to where you're like, hey, I have all this experience.
Yeah,
I
that's
know.
you can go ahead, Lloyd.
Okay, just quick. I know that Duke and VCU both have like summer programs that are specifically for pre-PTs. And I think with both of those programs, if you get accepted into the summer program, you automatically get like moved into the next step of the application process when you're applying to PT school. We can try to maybe find like the link to those. They might be closed for this cycle, but I'm not sure like where you all are in your education. But I know Duke and VCU both have like summer internship programs for PT.
I
I
think
can't
Janae
find.
has,
Yeah,
yeah, Janae has
Great.
followed that on her Instagram page.
Perfect.
You
yeah,
like drop your, you
yeah.
can
Instagram
going in
keeps
and out.
changing. So I don't know how to share stuff. I'm trying to find a link on my PT page, but because I have two posts about it. Different programs you can go to during undergrad. But yeah, I can't find the share button. So I'll send that before the end of the day.
You could also reach out to I know for me, I want to go into sports. So what I was doing was reaching out to different coaches, head coaches, and athletic trainers, and just asking about shadowing hours. Not trying to do any work, not trying to look for a job. I just wanted to just be in the setting and just be able to be a fly on the wall, just so you can kind of just see what it looks like, see if that's something, and that could be something that even you can do for something else. Like it doesn't have to be sports specific. Like you can email any other type of profession or any type of clinician that you think you may want to be around and just inquire about shadowing just to kind of get that experience. You could also put that on your you can't put that on your resume per se, but you could put that on your application when you do apply for PT school to say that you do have some shadowing experiences in these different specialties, which would kind of help you stand out because you kind of show that you've taken the initiative to get a better understanding of the different specialties.
I think Lydia touched on this earlier, but in regards to like building your resume, definitely having a lot of different extracurricular activities, ones that may not even pertain to physical therapy, because as an applicant, they like seeing a variety, not a variety. What's the word I'm looking for?
Diverse.
No, that's not what I'm looking for.
I think it might
Anyway, huh?
I think it might be variety.
Is it variety? No, that's not what I'm looking for. But anyway, just having a just having a lot of different extracurriculars on your resume looks really, really good. Well-rounded, a well-rounded candidate. There we go. Because they know that you're interested in physical therapy, obviously, because you're applying to PT school. But we all have different things that we're interested in outside of PT. Like the world doesn't revolve around it. So having different types of like leadership positions, different clubs and stuff like that also looks really, really good on your application. Okay. What can you do to make yourself the strongest candidate for grad school?
I think you could, on top of all of the information that we've just kind of discussed as far as getting your resume together, I think as far as when you start applying and doing those essays, I would say be yourself for sure, and don't be vulnerable, but open the door up a little bit to let the people that are reviewing your application to get a better sense of who you are, so that they just don't only use these different grades, letters, exam numbers to try to make a decision based off who they think you are. Like let them get into understanding who you are as a person, the things that you value, the things that you appreciate, and that'll give them a better sense of who you are to let them know if you are a better fit for a good fit for their program, because a lot of like our school didn't do an interview process. So if you forgive my language, if you half-ass the essay and didn't like really pretty show who you are and really go deep down, you probably didn't get accepted. So yeah, I would just say be open, answer the questions to the best of your ability. But yeah.
I think piggying back off what CJ said, and he also kind of alluded to this earlier, and I want to say something, but when you're applying to PT school, if you all are planning to apply, if you properly prepare, you will get in. You will get into PT school. It's not impossible, like it's an achievable goal. And you should really look into what school you're applying to. And that's something that I didn't do that I wish I had done. I was just hoping to get in somewhere. And I got accepted into a couple of schools. And I didn't take the initiative to look at what that PT school specializes in, what type of student they want, what they push out, what they're teaching. I didn't look into that before I applied. So I think looking at the program, looking at who's in the program to see if that's going to be a good fit for you. Like when you remember, like you're also interviewing the school. The school isn't also just looking for students. You're looking for a school that's going to fit your needs because physical therapy school is long and you need support. So something that could help you like figure that out or even make you stand out a little bit is calling the school that you're planning to apply to, asking to speak to someone. I would try to speak to like a professor because the administrative people usually aren't the ones teaching you. So if you talk to like a professor, they can probably give you more insight about the actual program, the curriculum, and things like that. I think definitely that'll help you stand out, and it'll show that you've done the work to, especially if you know someone on like on the website, if you can call someone by name, like, oh, is this person available? Is there a time that I can set up to meet with them to talk about the program or something like that? That for sure will probably make you stand out.
Yeah, even if even if you ask a question that you already have the answer to because you already seen it on the website, it is still good to reach out to somebody just to get your name out there and just so they can maybe put a personality or a face to this name. So when it does come time when they review applications, they can say, "Oh, I do remember this person." Blah 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 blah.
Some good questions may be like, what's the ratio between student to faculty members or students to lab assistants? Or dang, I had a few. Or what do you all like, how do you all support the group when you see that someone's drowning academically? What is like the criteria to pass a class? Things like that that really matter when you're in PT school.
Also asks, what does mentoring look like as far as is there mentoring within the program? And if there is mentoring, how is your mentor selected?
All right. Is GPA the major thing that these PT schools look at, or do they majority look at the person?
I think it depends on the PT program. So I went to a lot of like informational sessions for different physical therapy programs, and some schools said that they mainly looked at GPA and GRE scores, and then other schools like they looked at those things, so like they do matter, but they valued the interview a lot more than like the GPA or GRE scores. And then like some schools, like our school doesn't do GRE take GRE scores anymore. So I think it really just depends on the school, and you should ask those questions in like interviews or with in those informational sessions.
Yeah, I agree with Jayla. I know GPA is pretty important. Like it gets your foot in the door. Like if you're applying to PT school with a 1.2 GPA, it's probably not going to cut it. But no, just getting it to a point to where you know that this is a fight that I can take place in. Get your foot in the door, and they take into account a lot of other aspects other than your GPA, GRE score, because most PT programs want to see who you are outside of the classroom too. Because kind of like I was saying earlier, a lot of PT is how you interact with people, how you relate to people. So being very smart and having a lot of baseline knowledge is good, but if you don't have the skills to relate to your patients, it doesn't matter how much you have in here, you're not going to be able to connect to your patients and have a buy-in to what you know.
Also a lot of most PT schools, they'll have the stats of their previous class that they admitted. So they'll have like the average of their GPA and their average of their GRE scores, and that's usually on the website. So I would definitely take a look at those because across the physical therapy programs, they're all pretty similar. So just to give you like a range, and then even like with my GRE scores, like I didn't want to retake it, but I was like, this could be better. So I emailed some of the schools. And I'm like, I noticed that you have your GRE score cutoff is 150 for this category or 300 or whatever. I got this score. Like, would you all still accept me? And then they would respond like, yeah, like we accept people or with this score and blah blah blah. So they might give you even a better range if you just like email them and ask them as well.
To piggyback off what Jayla was saying, don't give yourself the short end of the stick just because of what your baseline is. Because personally, I wasn't going to apply to WashU because I was like, I could never get into that school. Like, that's number one, like, absolutely not. So I was like really selling myself short because of the statistics that I saw on the website. Like, I didn't have that GPA or that, though they didn't have GRE, but just basing it off of that and just like the intimidation of it being the number one program, I didn't want to apply, but my dad was actually the one that pushed me to do it. So I would say even if you don't meet that criteria, like Jayla was saying, like email them, but also like give yourself a shot because you just never know. And you might be surprised by getting that acceptance letter in your email.
I just wanted to go off of that too. Having confidence in yourself and not selling yourself short, because sometimes we come from environments that will tell us that, oh, we're not typically in these spaces, so it'll be hard for you to get there. So then when you do finally get the opportunity to go there, you're all like, oh, I'm gonna just go with whoever take me because somebody said I wasn't even gonna get here in the first place. But you're worth so much more than that. The fact that you even want to pursue something like this or physical therapy just shows like your compassion and your drive for just anything in life. Truly, that's what the profession means to me. But yeah, you're worth more than just the first school that call you and say you're accepted. Like, shoot for the stars and consider all your options truly, because yeah, we're worth more than what anybody else can tell us.
What do you wish you knew before you entered the field? How much debt I was going to be in?
That was my answer too. No, I think this is definitely the field that we all want to go into. I mean, obviously, we made it through the program. We're all looking for jobs, but I think doing more of the front work on looking at the financial aspect of it too was something that I might have been a little more naive of when going into PT school, thinking, oh, it's going to work out. It's fine. It's fine. And then they have the big meeting where they call you in at the end of your third year. It's like, these are all the numbers. Like, this is what you got to pay back on. And it's kind of a good dose of reality comes in. So it's, manageable. It's just another bill that's going to be coming in like the others once you enter adult life, but definitely having more awareness of kind of the financial aspect of, paying back on school, like once we're graduated.
I think also knowing, because I don't know if you guys knew it beforehand, but knowing that there are resources out there to combat the student debt. They did not teach us anything about public service loan forgiveness, all these forgiveness programs out there. If you say work for like a nonprofit organization for 10 years, you sign a 10-year contract and they'll wipe your student loans. Like these were things that weren't discussed and I recently just found out about it this year. But there are resources out there that you may be able to get your loans paid off. Or you can also take the route of like just paying them off as you go along, like a lot of people do.
Now, there's also the option of asking wherever you find a job, asking them if they have a tuition reimbursement program. So your job is going to put a certain amount towards paying off your loans each month. So that kind of helps with the buffer, and you can just add on top of that as well. So it takes a little bit more of the burden off of you to fully be responsible for paying off those loans.
I think like kind of switching topics a little bit, something that I just didn't consider at all when I was going into PT school because I was so focused on wanting to get in was thinking about like working, like what my life is going to look like while working, what a full-time job looks like. And once I started clinicals, I realized that's not for me. And so I will never, never work full time. Never. I won't do it. I won't do it. And throughout PT school, I've learned there's so many options. Like you can do PRN, you can do travel, you can work for like different companies. And that's just something I never thought about when going into PT school. PT school is very draining. And then you're working like upwards to 60 hours with the documentations a week. It's too much. And just branching out and looking for those options while in PT school or before you get into PT school probably will help narrow down what you really want to do. Because I'm just personally, I don't want my life to be like there's more to me than being a physical therapist, and I don't want that to become my identity. And I think just thinking about that before PT school and while in PT school will help you like branch out and look for those different creative jobs that are out there that offer you a better work-life balance.
Okay, what would you have done different to help you be a better prepared in the field? I don't think that I would have done anything differently. I think I was pretty prepared, personally for physical therapy school. And I did like a lot of extracurricular activities that I feel like made my resume pretty strong. And I think also because I knew in undergrad that I wanted to go into PT school, I like always had that mindset of like I have to get like good grades so I can get into PT school. And like I don't know, I was also like always just trying to like make sure I have like leadership roles, not just I don't know, I think I just like being a leader, but also like it looks good on your resume. So I don't think that I would change anything.
Is the question, I'm sorry, is the question about changing something, did you say changing something like while you're in PT school to be prepared to become a PT or preparing to get into PT school?
I think it was more general. So just something that
Preparing to get into PT school.
Okay.
Oh, okay. Yeah. Like I said, the only thing I would have done differently is I mentioned this before, but just basically really looking into the school that you're applying to and not just like everybody else has kind of touched on, don't count yourself short. Don't think that I just hope I get in somewhere or just wanting to go to one particular place. Just really look at what type of student that school wants, what type of clinician they're producing, and see if it meets the type of PT that you want to be. That's the only thing that I would have done differently. It's just done a little bit more research on the PT schools that I was applying to.
I think I would have sought out a mentor during undergrad because I didn't know that I wanted to become a physical therapist until my sophomore year of undergrad. I was a pre-pharmacy major my freshman year. And so once I jumped into the PT realm of like PT cast and all of that, I was confused because it's a super tedious process and you have to obtain so much before you even apply. So I think having a mentor would have bettered my opportunities of getting into PT school the first go around, because I applied, didn't get into any schools my first year. So, but then I got in my second year. So I think it would have made the process a bit easier and less stressful if I had some guidance. And I think that's what the whole purpose of this is, to help y'all, give y'all some insight on like what you need before it's like kind of like too late in a way.
I definitely agree with Sydney. I was able to get sort of a mentor through my advisor at CMU. She was actually a PT and was trying to start up the PTA program at CMU. And so just being able to, find a connection and having that mentor to lean on to help them guide you on everything that you need to get prepared for PT school, with classes you need to take, different opportunities, volunteer, internships that could help. Just having some guidance is definitely helpful.
Um, I guess I agree with everybody. I think everything went pretty much according to plan. I don't really think if I didn't have whatever happened before PT school happened, I probably wouldn't be here today, or wouldn't be at this moment today. So, but I will say, if I could go back, I wish on top of not getting the masters, I wish I would have removed a lot of the distractions that I had earlier, because I had more than enough distractions leading into PT school, and those distractions had an effect on just my overall performance during my first year. Um, Once I realized what those distractions were and removed those distractions, then I started to my grades and my time at WashU started to improve. My grades got a lot better because now my focus was where it needed to be, and I didn't have those different things pulling my attention 5 different ways.
We have one more question from Instagram. It says, what was your best source of study material or study routine? We kind of talked about study routine, but study material.
YouTube.
Yes, YouTube.
I'll elaborate. It was kind of a joke and kind of not at all. But I, especially for like cardio poem classes, I watched a lot of like Simply Nursing videos, and yeah, I love those. Like, yeah, I think I showed you, Lydia, but that's besides the point. But they have like little animations that and mnemonics that help me remember. And I like learned that I really do like mnemonics so that I can visualize things. Also there's videos on YouTube called Osmosis, and those are also really good and breaks down um like things like physiology and diagnoses, diseases. So because I'm like a visual learner and like listening, I would use that a lot. And I also would rewatch videos that I felt like were really, our lectures are recorded. So I would rewatch the lectures for lectures that I felt like were like really important, that I just like needed to hear it again versus just like rereading it again.
Engineered also has really good YouTube videos.
Yeah, I would say you pretty much are going to get the material that you need from whatever program that you're at. They'll have like a set of books that you need to get. And for our school, honestly, I did not read one single book that they gave us. They gave us PowerPoints, and that's what they were testing us on. And I would just study from the PowerPoints. The only time I bought a book was to study for the boards. And I would, like Jayla and Nehemiah said, go to YouTube to get a more like visual picture of what is being like presented to you. That really helped the information stick a bit better.
Oh, for anatomy.
Yeah, I was
what's
about to
the thing
say
that we
that app.
yeah, that app me, Sydney
That
and
was
Lydia.
good.
We shared an app. Um, what was it called?
Complete
But
anatomy.
what is it?
Complete anatomy.
Yes. So we had a complete anatomy, and Sydney's
Sydney.
dad also bought her a skeleton, which is great. But for anatomy, it was really nice because we could like pick a muscle and we could like add the tendons, go down to the bone. And it was like really nice to visualize how it showed you how the muscle works. So like say if you're like looking at the quads, like it'll actually show you the knee extending and like where it contracts and all of that. And I thought that was really nice. So if you're gonna buy anything for anatomy, I would buy like one of those apps, like Complete Anatomy. And CJ, which one did you use?
I've been using to study for boards. I've been using KinHub,
No, for your anatomy.
Anatomy,
Could you
Essential
use something?
Anatomy.
Yeah.
It's called Essential Anatomy.
So that one's like that one's cheaper than Complete Anatomy. It was why like we shared an account for the Complete Anatomy because the Complete Anatomy was like $40. And I don't know. It was
Like it was
expensive.
75 or something. Yeah.
It's
Yeah.
40 right now from when I looked at it last. And I know some of my friends said for Black Friday they had a sale where like it was like maybe 20 or something. So if you catch it on Black Friday, you might pick it.
Oh, did we answer this? What are mandatory things we should do as undergrad students?
Do the prereqs for the PT school you're applying for, and make sure you make good grades, a B and up.
Have fun.
That's not mandatory.
Mandatory. Yeah, definitely just the prereqs and the volunteer hours. Or like every school, I believe they have like their minimum shadowing hours that are listed on PTCast. Those are like the mandatory things. Like the prereqs, make sure you have a good grade and make sure you have the shadowing hours, like bare minimum.
And letter recommendations. Yeah, forgot about that part. Make sure that you have really good connections with maybe like your professors or people from, I got one from like one of my clinics that I observed at. Just network, and because those people can write your letters of rec. And I think they have like a max of like, you can put 5 in there, I think now, from
Yeah,
back in the
like unless they changed it, you have to have a physical therapist
Yeah, physical therapist,
write one
professor.
recommendation. So if you make good relationships with the people that you shadow with, because those people are going to be the people that have to write your recommendations and also confirm your volunteer hours.
Yeah. Then we said personal statements are required. Extracurriculars.
Also, if you are working as a PT tech, rehab aide, physical therapy aide, however they want to call it. It's pretty much the same position. Put that on your application and resume as far as your job experiences, but also those same hours you worked also count as observation hours as well. So like you don't have to be pressed to say, oh well, I was working but I don't have any observation, because they want to see you having some type of shadow on the observation hours as well as you apply for school. So you can also use that time that you worked as your observation hours.
I think on PTCast, when you go to the observation hours section, they have, if it was paid, unpaid, like volunteer, I think it's like a box that you check off so that it would count if you were working there.
And that's one of those things. So that's one of the things I didn't know. So when I first applied to PT school, I had only worked, but I didn't know that those were observation hours. So when I was doing my application, I did not put that down as observation hours because I didn't think that counted as observation. And then I think that probably played a factor in why I wasn't accepted based off why I wasn't accepted my first time around, just because of the things that I didn't know I needed to put. And that kind of goes back to having a mentor and having somebody kind of help you through the process so that you can know what to do and what not to do. Because I mean, being an undergrad student, you're not expected to know all the ins and outs of how to get to this point. Like somebody should be able to help you get there.
Also, this isn't mandatory, but it looks really good on your application if you take classes that are a level above the prerequisites. I think it helps make you stand out that you took the harder courses opposed to what they're asking for. It's just like it just looks good.
And also make sure your prerequisite will actually transfer, or not transfer over, but actually be credited and I don't know how to word it, but I guess credited for the application process or credited for PT school. Because when I was an undergrad, I had to take chemistry 4 times because I took chemistry I transferred to from one undergrad to another. The first undergrad I took chemistry, and my advisor there had me in the lowest chemistry tier possible, which I mean, I didn't know that. I was just taking chemistry. So once I did my chemistry 1, 2, I thought I was done until I transferred to my next school. And then the hours themselves transferred over. But as far as it being applied as a prereq for PT school, they didn't count. So I had the hours, but I needed to take chemistry all over again. So make sure you speak with your advisors. If PT is the route you want to go, just to make sure the courses you are taking directly align with the prerequisites for the program.
And if you're unsure about the prerequisites that the PT school will take, you can email the administration while you're doing like your search for PT school, and they'll let you know as well. Because I used to send emails like, y'all sure y'all gonna take this? It was at a community college or whatever. Because that matters too. Like sometimes PT schools will be like, we only want your prerequisites to come from a 4-year university, or they can come from a community college as well. So check that. Make sure you double check that too.
Okay, do y'all have any like last minute questions before we start wrapping it up? Thank you for asking all your questions as well.
Can we know where y'all from? I'm just nosy. If you feel comfortable sharing.
Hey, I'm Kayvon Maloney. I'm from Pine Bluff, Arkansas, but I go to school at Southern Arkansas University.
It's nice to meet you. Thank you for coming to our little Zoom thing.
I'm just in Central. I'm from Chicago. but I attend North Carolina Agriculture and Technical State University.
Nice. Thank y'all for coming, and I hope that this was beneficial to y'all. And if you want any contact from any of us, I know I'm open to helping y'all through the process if PT is something that you want to pursue. I know like Sydney and I just started dropping our Instagrams, but if anybody want to drop their email or something, or y'all can send us y'all stuff, do that. But thanks y'all for y'all time. And Jonathan, you studying. Thank you for coming, man.
No problem. We got a HEP for a neuro patient that's due this week, right before midterms. So I was paying attention, but also looking at that a little bit.
Yeah,
So,
get it done.
yeah, you know how it is.
Cool. Well, y'all ain't gotta go home, but
All right. Thank y'all for coming. This is great.
yes.
And congratulations to everybody that passed boards.
Woo,
Woo!
woo.
Officially PTs.
Yay!
Let's go.
Congrats, y'all.
Thank you.
Thank you.
Thanks.
We official.
Yeah, Nehemiah, you passed.
I did, yeah.
Raise the roof.
So all Black people pass that.
Yeah.